Good afternoon, everybody, and welcome to this plenary session. This is what the topic of this one is: environmental sustainability in the health sector, a shared ambition and collective efforts. I'm George Valiotis, and I'm the Executive Director at the European Health Management Association. So this session explores the incredibly important topic of environmental sustainability in health systems. And I want to give special thanks to MSD for their support of this session. Now more than ever, it is very easy to understand that the link between health and environment cannot be separated. For example, COVID came about from environmental degradation. So the first group of speakers today will look to policy such as the European Commission's Green Deal and drill down into concrete implementation and actions by all stakeholders involved: industry, healthcare organizations, health professionals, and even patients. And then one element of environmental sustainability that the second group of panelists will explore more deeply is antimicrobial resistance, or AMR, which is described by the World Health Organization as an increasingly serious threat to global public health that requires action across all government sectors and society. And last year, the WHO included antimicrobial resistance in their list of the top 10 global health threats. So let's start then with getting right into the discussion and with our first panel. And I'm going to introduce you to the panel, which includes Ferenc Marovka, who's from DG Sante and the European Commission, and then Jess Mcnamara from EPSA, which is the European Pharmaceutical Students Association. And then the last speaker of this panel will be Dr. Kirsty Reid, who is from FPA, the European Federation of Pharmaceutical Industries and Associations. So let's start with you, Ferenc. So can you give us an overview of the pharmaceutical strategy for Europe?
Well, thanks a lot, George, for the introduction, and I'm very pleased to be invited here. So what I would like to talk about today a little bit is the pharmaceutical strategy for Europe. This is kind of Europe's blueprint for the upcoming legislative work for the mandate of this current commission. And this pharmaceutical strategy actually aims to cover the full life cycle of the medicines, from the very scientific discoveries up till the market approval and use, and later maybe until the generics. And it not only takes the full life cycle of the medicines, but it brings together the different policies that are relevant for the medicines. Well, it will cover, of course, research and innovation. Apart from health, it will also deal with trade and competition issues, but also environmental policies, which I think very relevant for today's talks, are considered. Well, the strategy doesn't come in a vacuum, and actually you will see yourself, the strategy will be published on the 24th of November, so very soon, but it doesn't come in a vacuum. The Commission have already three main, very important strategical directions or policy documents that are already out there and influencing it. One is shaping Europe's digital future, Europe's digital strategy, Europe's industrial strategy, and the European Green Deal, the topic of our session as well. So the pharmaceutical strategy is actually placed in the industrial strategy, and you will see once the document is out that has its traces on the document. Of course, it will deal with innovation, it will deal with competitiveness, it will deal a lot with manufacturing, with the autonomy of the European supplies, shortages, a lot of lessons learned from the coronavirus. But it also has a very substantial part on the environmental aspects. And these environmental aspects are related to the pharmaceutical residues that get to the environment, either through wastewater or by bad waste management or through the manufacturing process. So the EU plans for the future to revise its environmental risk assessment, which is now prerequisite for any new medicines to be approved, beef it up a little bit, make it stronger, and also to cover those areas that were, or cover those medicines that came to the market before the risk assessment was required. This is the main points, and I think we can continue further discussion on the other details.
Thanks very much, Ferenc, for sort of starting us off on that. And we're going to delve into that a bit deeper. I want to turn to Kirsty Reid. So she's the Director of Science Policy at FPO, as I mentioned, which is the European Federation of Pharmaceutical Industries. So Kirsty, how does the pharma industry see the European Commission's Green Deal that Ferenc referenced being part of this whole lattice of policy that's happening?
Thank you. So yes, the European Federation of Pharmaceutical Industries and Associations, just briefly, we represent the biopharmaceutical industry operating in Europe, and we're extremely engaged, of course, very closely on the topic of the pharmaceutical strategy. Excuse me, but I'm sorry, I didn't bring my water along.
No problem. You take a moment to clear your throat. And...
Okay, sorry about that. But as has been mentioned, we have to look at it from a holistic view. We have the industry strategy, the digital strategy coming from the Commission, the chemical strategy, all the work on innovation and manufacturing. And of course, this all is incorporated within the green agenda of the Commission. Now, our industry sector is committed to making a positive impact on the lives of patients, but while operating sustainably. And therefore, we've welcomed and actually embraced the Commission's focus on the green agenda and on a more sustainable Europe. On numerous of the priorities which are identified by the Commission within the Green Deal, FPA and our members have been working quite actively over a number of years already, where we focus on sustainability, on the pharmaceuticals in the environment, which has been referenced closely with the pharmaceutical strategy, with mitigating climate change and also the move towards circularity. We look forward to continue building on our work and engaging on the rollout of the Commission's policy priorities. We do recognize that reducing our environmental footprint is an important step we can take to positively impact human health. And it has been well documented that climate change, for example, can adversely impact on human health, as it influences on the health can be direct or indirectly due to infectious diseases. We've already mentioned the COVID and the environmental degradation being a part of that. It comes through also flooding, risks of drought, subsequent food insecurity, and increasing respiratory diseases for poor quality air. And therefore it's estimated, even by the WHO, that 1 in every 4 premature deaths today is due to environmental factors. Thus, this illustrates to us that our personal health depends very much on a healthy planet. So therefore, driving this motivation, therefore, by the pharmaceutical industry to improve human health and well-being, we're further understanding these impacts and interfaces between the people, between the health and the environment is critical for us to develop and decide on how we will respond to these. We've been committed to contribute responsibly to the progress in regard to carbon dioxide reduction targets, specifically addressing the increased energy efficiency and lowered energy intensity across our value chains. In addition to this, early evidence suggests that innovation that improves health outcomes while optimizing resources also reduces carbon impacts, as our mission is to create a collaborative environment that enables our members to innovate, to discover, to develop, and to deliver new therapies and vaccines for people across Europe. We believe that innovation is one of the things to consider in the resources to reduce the footprint on addressing diseases. We also bringing the topic of circular economy. The implementation is fundamental to help limit a global temperature increase to less than or equal to the numbers have been reported as 1.5 degrees that we should aim for. And we welcome the opportunity to be part of these solutions by working collaboratively with the EU in shaping the legislative framework. Later, I may go into some details of what our companies have been doing to progress on the circular economy. And then, as I know that part of the discussion today is also on how these link up, and the work of the Green Deal links up to that of the UN Sustainable Development Goals. We feel that we, with the work that we're doing, we can influence goals, I think 1, 2, 3, 6, 7, 9, 12 and 13, on no poverty, on zero hunger, on good health, on clean water, on clean energy, industry and infrastructure, responsible consumption, and climate action, respectively. So I believe that the activities that we're engaging with, that we are engaging at the level of the European Commission and with other stakeholders will help us to move forward on these issues together.
Thanks, Kirsty. And I'm taking notes fast as you list through a lot of things there. It's impressive to hear about like all of the plans of how industry are actually implementing these things. Actually, now would be a good time, if you don't mind. You said that you'd have some more examples of specific things industry are doing. Could you speak to those?
Yes, I can. So let's look at for chemicals, for example. Chemical processes comprise a significant portion of medicine's environmental footprint. And responsible use of chemicals is also a key environmental stewardship priority for our sector. So many of our member companies are leading projects and initiatives to minimize the impact of their manufacturing processes, including the reduction of the generation of hazardous waste, for example, and also using greener solvents. For climate change, there are numerous initiatives by companies to reduce the carbon dioxide emissions at their company sites, and also to switch to alternative energy sources. Now, these could be by biofuel, wind farms, by deep geothermal energy, and also initiatives driving the reduction of the Scope 3 emissions down the whole value chain. Also, some of our companies have established strategies to become carbon neutral in the coming decades, in line with the Commission's proposals. For circular economy, the innovation to become circularity will help drive the new opportunities. The pharmaceutical industry is implementing a number of activities and initiatives to transition towards circularity through the design of products, processing and packaging for resource efficiency and value chain collaborations. And then quite specifically, and work that we do very much in collaboration, is that of the pharmaceuticals in the environment, where we're quite active with, first of all, we recognize the concerns that are raised about pharmaceuticals reaching the environment. We've been proactively engaging, not just recently, it's been for the past about 10, 6, 7, 8 years, where we're part of the Eco-Pharmaca Stewardship Initiative. Now, this is between FPA, the ASGP, and Medicines for Europe, where in collaboration, we strive to protect patient access to medicines while appropriately considering the environmental aspects by strengthening the environmental risk assessment process and considering the entire life cycle of medicines. So part of this, the Eco-Pharmaca Stewardship, the AMR Alliance, which will be on the next panel later, and also the work we're doing on meds disposal, which is about how to dispose of medicines across the different member states. We feel are ways of measuring, mitigating the whole environmental concerns. And then just quickly, we also work on numerous public-private partnerships through the Innovative Medicines Initiative to look for greener economy and for greener manufacturing processes. We have 3 specific standout projects that have been running over the past 3 years. One was on the intelligence-led assessment of pharmaceuticals in the environment. And this project ran until 2019 and delivered a framework of tools, assays, and models that could enable industry, regulators, and academic researchers to identify the priorities and medicines that were likely to bring risk to the environment. And just recently in September, we kicked off a second project with the public-private partners called Premier. And this is a sort of a follow-up from IPI, and it will also help to facilitate the identification of potential environmental risks associated with active pharmaceutical ingredients earlier in the development phase. And then there was one last project I'd like to refer to just quickly, is that of the Chem 21. This was a project that ran from 2012 to 2017. And it was designed to develop a green chemical manufacturing method. Now, since the project has come to an end, this processes developed under this project are now being implemented not just in Europe, but in Africa, to help reduce the industry's carbon and environmental footprints. So again, sorry, a long list, but it's a very important issue to us, very important topics, and ones that we're really working on to move forward on.
I sense that, I mean, there's a lot of things there. So what I want to say a couple of things. So the first thing is a lot of our audience are working either at a policy level or at a practice level. So a lot of people who might be joining today aren't engaged in these policies in any way at all. So I want to ask you, Kirsty, one more simple question, which is, could you explain in real simple terms, what is circular economy? Because that might be one of the terms that is newer to people who might be joining.
Yes, and to describe it, it's sort of like we call it circular. It's meaning about not bringing any products into any waste products out. So it's about reusing, recycling throughout the whole process, so that we're making sure that very little escapes into the, be it through packaging, through pollution, but that it doesn't go back into the environment, but that is being part of a reusable, recyclable process.
Great. And because you mentioned so many things, what I will remind people is if you go into the conference program application, you can go to the MSD booth, and in the MSD booth, there's lots of resources there and information. So if you're feeling a bit overwhelmed with so many things being mentioned, firstly, stay true. We're going to keep talking through these things, and you'll learn more and more as we go, but there's also resources available to give you more details. So I want to move on now to Jess Mcnamara. Jess, thanks for joining us. You're the Vice President of the European Affairs at EPSA, the European Pharmaceutical Students Association. And it'd be great to kind of get your perspective on drilling in a bit more as well. What do you think the new ambition for an EU green agenda means to young pharmacists?
Yes, hi everyone, my name is Jess and I am indeed the Vice President of European Affairs at EPSA. So just to give you a little bit of a brief background, I'll try to keep it short. For those of you that don't know, EPSA represents over 100,000 students and recent graduates across 37 countries in Europe. And our mission is to actively engage at both the student and professional level to bring students up to date with what's happening on the EU level. So recently, we did release a position paper on pharmaceuticals in the environment and its education in the pharmacy curricula. And this position is important because it highlighted that pharmaceutical students are not educated enough on how pharmaceuticals can negatively impact the environment due to their incorrect disposal or overuse of medications. So like what does the ambition for a EU green agenda mean for young pharmacists? I think it's quite a difficult question because like obviously the environment is really important for youth because of the environment becoming more prominent each year and the issues that go along with it, and that it's also very visible on social media amongst young people. But for young pharmacists, I think it highlights the importance of public health in the environmental context and how healthcare can have a big impact on it. However, I do think that young pharmacists are not entirely aware about how the pharmacy profession impacts the environment in regard to misuse of antibiotics and the incorrect disposal of medication. And I think that more emphasis needs to be placed on this during college and in the workplace, whether this be in community pharmacies, hospital, industry, or regulatory. It applies to all of us, and I think that this will also help to help young professional pharmacists to understand the concept a bit better.
Okay, so that sounds to me then like there's a need for more information and more learning. Do you see from your perspective, Jess, is there a difference between the younger generation, the newer generation of pharmacists versus people that you're learning from in the field? Like, do you see a difference in understanding of these things, or are we all on the same page?
Again, I think it really depends on your situation and what kind of background you have in pharmacy. I'm from Ireland and I've just recently qualified as a pharmacist, and I've worked as a locum technician a lot in the last couple of years. So I've gotten to know a lot of different practices in Ireland and you know, what's bad, what could be improved upon. But I don't think that a lot of pharmacists or young pharmacy students across Europe get this education in faculties of pharmacy across Europe. So I think that like the Green Deal has raised more awareness about sustainability and protecting the environment among students compared to other generations. However, I don't think it's thought about enough because there are evident gaps in the curricula regarding correct disposal and usage of medications. And I think that if this was tackled correctly throughout college studies, there would be a greater impact on newly qualified pharmacists than in the previous years when environmental issues weren't as prominent. So hopefully the EU Green Deal can help to shed a light on the gaps, and that changes can be implemented within the next couple of years in the curricula.
So Jess, I might come back to you then after we've heard from the next panel to ask you some more questions about how some of these changes might be implemented. And I'd also encourage the audience, like if you've got any questions as these things have been coming up, feel free to tap them into the Q&A box at the bottom. I can see questions are already coming up, and we will come to all of the questions at the end. I see a question already from Annelies van der Berg. Great to have you with us, Annelies. We'll get to that at the end. But Jess, or the panel, you can even read that question while we go along. So if I can have the slide for the next panel, what for me was really interesting about what Jess was saying is that there still isn't enough information and awareness about the impact on the environment, and especially about pharmaceutical students being prepared to advise patients on the proper use and disposal of pharmaceuticals. Like if they're not getting that information, then there's a lot to do. And it's a big topic because we've already heard sort of the framing of the first panel. They talked about the European Parliament having, they didn't talk about it, but there is a European Parliament strategy approach to pharmaceuticals in the environment. There's currently a public consultation on the circular economy, so that was referenced, about zero pollution and the action plan. And we know that the European Commission wants the EU to be carbon neutral by 2025. And we had Kirsty sort of mentioning some of the initiatives going there. So there's a lot going on, but there's a lot going on. And so then one of the key issues is about what then happens with antimicrobial resistance. And so I want this next panel to really talk about that, around of all these environmental things happening, what about particularly when it comes to antimicrobial resistance? So joining us for this next panel, we've got Dr. Amy Murray. She's the Environmental and Sustainability Institute at the University of Exeter. We've got Kawaldeep Semi, who is from IAPO, which is the International Alliance of Patients Organizations. And we have Dr. Joan Griffith from MSD. So I want to start with Kawaldeep Semi, if you don't mind. So Kawaldeep, thanks for joining us today. It's great to have you with us. Tell us a bit about the role of patients in the reduction of the impact of antimicrobials in the environment. I mean, we heard from Jess that some of the professionals struggle with this information. What about patients?
Yeah, exactly. I'll start from the ground zero first, that you have here patients who are immunodeficient. Sometimes many of the autoimmune diseases and others have been caused by the environmental factors. So you have patients who are very vulnerable to the environmental situation. Now, the second part is that in the rational use of antibiotics, that's where the big important issue comes in. We know that from when the EHMA Action Fund was launched, and also at our Global Patients Congress, which held in September, the UK envoy, and who was the chief architect behind the EHMA Action Fund, Dame Sally Davies, had said, this is a pandemic waiting in the wings. If you think COVID has got us all running around right now finding solutions, this is a pandemic that's going to come over and we'll have no solutions yet. And part of that strategy now to control this is that patients, firstly, have to take action in their behavior patterns and engagement within the health systems. Ensure that there is rational use of antibiotics, there is good stewardship, make sure that we don't become the pushy patients that people sometimes see. It is not sort of necessary that if you go into a general practitioner and you have to come out with a prescription, please do understand what the viral issue is, what you can overcome through rest and proper diet, and only rely on antibiotics where they are. Second is, I think, the rational use of the antibiotics themselves. I think many of our patients are notorious in that they don't finish their courses. They just leave The moment they think they're well enough, they leave the full dose and course, and that means it's an issue. And third, I think from low and middle income countries, we're getting this example where people think if they bought something, it's for them to use as they like, and they then start dishing out these antibiotics to family and friends, self-prescribing, self-medication, and that becomes a big issue. So we're saying that working with a young pharmacist, and let's look at disposal strategies that are there. And lastly, I think we need to get patients involved in the policy infrastructure, supporting research on AMR. And when we do get the new antibiotics found out and reserved, we should be sitting on those licensing bodies that control it almost like atomic particles or atomic fission matter, that not even a single tablet goes out without notification, without certification, and patients should be part of that. And it's up to us now to educate both ourselves, as it is for pharmacists to look at the pharmacist and the doctors for the doctor. So we don't have an acquisition that is pushy patients and pushover doctors and pharmacists causing this problem. So that's where we stand.
Okay, so Karldeep, thanks for that input. It's great to have you here and sharing the insights from the patient perspective. The first thing that you said that struck out to me was that this is the next pandemic. And like, I'm aware that it's something like 670,000 resistant infections a year that we get, and up to 33,000 deaths per year. Like, it's actually quite a big, serious issue that clearly needs to be spoken about. So a good thing that this session's happening. But for me, what I'm hearing from you is that the patient health literacy about needs attention. We know that there's also workforce attention needed. So is it about a better partnership relationship between patients and health workers? Like, what practically comes to mind to help? Like, what can we practically do? Keeping in mind in our audience, there's a lot of health managers who are trying to allocate their resources to get these things addressed better. What do you think could be done?
I think this is again what Joseph Kutchian, who's the economist at WHO, said. These are the neglected and forgotten parts of our health system, like health promotion, health literacy. We ignore these back parts, and this is where our problem started from. We must invest in this so-called public goods in the sense of that improve investment in health literacy, and especially in health promotion and public health. The second part, I think, which you addressed quite nicely, is that the bottom dollar is that patient education programs that traditionally we ran alongside. We had plenty of time then. I think this is what was. We had plenty of time and we could spend all the time. And thankfully, I think the pharmacists played a big role in this, that very often the general practitioner gives us 5 minutes, whereas a pharmacist can give us 15. And therefore, it makes sense that maybe there's a partnership role between pharmacists and expert patients to look at how we actually undertake this activity. And until COVID started, I would have said, well, digital solutions are difficult to implement. But suddenly, we are all aware of digital solutions. I think we must now all run shelter. We need innovative ways to work on this. And lastly, I think when Jess was talking about the role of the pharmacy, maybe we could look at that, the pharmaceutical industry. Maybe we could look at that, tripart, from, if you're talking about circular, it's all about getting the medicine from the manufacturer to the retailer pharmacist, to the patient, and back into the system, whereby it destroys it if it's not used. That level of life cycle has to be addressed, and we need to bring that back in.
Okay.
Everybody has a role to play.
So everyone does have a role to play. So that's the role of health management and of service providers. Karldeep, can you speak also to, what about the policy level? You did reference before that there are some licensing bodies and things that expert patients are a part of. Can you say a bit more about either how patients are currently involved in having their voice heard by decision makers at a policy level, or what else can be done by policymakers who are in the audience to better reach out and make their work available to patients to be part of the decision making?
I think the first one is at the topmost, the European Medicines Agency. I mean, it's Patients and Consumer Working Party. I mean, it's the best structure I've seen so far, in that anything that comes in for approval, patients actually quickly ask those questions, pose those questions. Has the manufacturer looked at anti-AMR resistance as a factor? Has the manufacturer looked at how is he or she going to, how are they going to address this component of it? How is that patient, the little, so far it comes in a little leaflet inside the product with, comes up with contraindications. We now would like to see, almost like the tobacco packets, you know, you have a health warning, a big stark red warning. Any product that is likely to be part of that AMR resistance has to come with that. You know, it's your responsibility now to take this carefully, make sure you don't do what you have to do. So that needs to become coming out in that product labeling and stuff. And lastly, I think simple things. Do get your map your expert patients. And I think this is what COVID revealed. When we were really running around trying to design shielding programs, many health systems did not know their patients well. They didn't know who they were, what their conditions are, where they lived. Please, let's go back and build back better on this. Look at who they are, where they are, and bring in those people back into the fold. And let's design those systems whereby we bring them in, they're taking care of all the education, all the literacy level, and from both the patients, and set up casual bodies, meet once a month, even quarterly, with the expert patients in your area, in your hospital. Make sure you have that infrastructure in place where you can talk freely and then take strategy. It's only through dialogue that we can really proceed with this.
Okay.
Otherwise, I shudder to think what happens if this gets out of control.
So a key message there is really increasing the patient engagement and better dialogue between patient, decision makers, and health managers. So you've talked a lot about patient experiences and what patients end up being stuck with or choices that they make. Amy Murray, I want to turn to you now. So you're the NERC Innovation Fellow for the Environment and Sustainability Institute at the University of Exeter. Thanks for joining us today. So you're going to speak to us about how human activities might influence the evolution of antimicrobial resistance in the natural environment.
Thank you for having me, first of all. And yes, so I work primarily on the environmental dimension of antimicrobial resistance. So there are several ways that human activities can increase or promote the evolution of antimicrobial resistance in the environment. So humans take antibiotics, as we know, to treat and prevent infections. But antibiotics are not fully broken down in the human body. They can pass through wastewater treatment plant systems and end up in the environment as active compounds. Similarly, the same thing happens in animals. We use antibiotics extensively in farming, and it's not fully broken down in the body, and animal manure is spread on agricultural land. You can have runoff, and then you get, again, active antibiotics in the environment. Aside from antibiotics, there are also other compounds which we think may play roles in the evolution of antimicrobial resistance. So some of these are biocides, chemicals that you find in disinfectants and detergents may also increase the evolution of antimicrobial resistance, alongside heavy metals, which you may find naturally occurring in the environment or in particularly industrial areas. Also, you can sometimes find them impregnated in clothing or in sterile dressings and so on. So then there are other compounds which they're sort of a new area of research which we're looking at that could also co-select for antimicrobial resistance, such as non-antibiotic drugs, so regular human medicines and also plant protection products. So all of these practices together means that we're releasing antibiotics and lots of other chemicals which could interact together to promote the evolution of antimicrobial resistance. Also via wastewater and animal waste, we have release of bacteria and resistant bacteria into the environment. So if you were trying to imagine a more ideal breeding ground for antimicrobial resistance to emerge, that might be difficult because you have the bacteria, resistant bacteria, and then you're adding in compounds that could promote the evolution of that resistance.
So there's quite a few things then, and I guess that's why our first panel really talked quite broadly about so many different things that are impacting on the environment. And the AMR, because you'd think in a way it's just the pharmaceuticals that we're taking, but it's part of a whole big chain. Is that what you're saying?
So it is much more than the healthcare sector. It's the agricultural sector. It's having clean water and sanitation is obviously a big factor as well. And yeah, we're learning more and more about other compounds which we previously may not have thought might have an effect, which could.
Okay, so I've got some more questions I'm going to come back to for you, Amy, but I will just remind the audience, if you go to the Q&A box, if you have any questions at all, do put them in there and we'll get to them just after our next speaker. And thank you to the panelists who are already answering the questions that have come in. So next I want to turn to Joan Griffith Tell. So she's the Director of Occupational and Environmental Health Sciences, Corporate Product Stewardship and Science Group of Global Safety and the Environment at MSD. That's a massive title, Joan. You've got a huge responsibility. And after hearing all of this conversation today, your portfolio must be exhausting.
Yeah, we're quite busy and quite dedicated to handling all these issues. I think the key piece of information that I was learning as we were listening to all of the speakers is that we have this global One Health issue, specifically antimicrobial resistance, and that everyone has their part to play. Patients, providers, the pharmaceutical companies, diagnostics, everyone has their part to play in trying to combat this. And the only way we can be successful is if we all work together under our One Health approach. You know, our company is doing many different things, mostly under the auspices of the AMR Industry Alliance, which is an alliance of several hundred healthcare providers that are trying to tackle this issue. We signed the compact at Davos in 2016. We have critical mandate to look at all different factors related to antimicrobial resistance, from diagnostics tools in hospitals. Okay, so let's make sure that we're giving the right antibiotic for the right disease, right? Let's also try to invent new antibiotics so that we don't have to rely on some of these older ones that maybe aren't working as well. Let's explore our vaccines. Let's look at tools and training for healthcare providers so that they can learn in the hospitals or in the clinics the appropriate way to handle antibiotics. But the one of the more difficult issues, but which is really considered like low-hanging fruit, has to do with antimicrobial manufacturing. So we're going to be looking at our factories around the world that are actually making antibiotics, and what can those factories do to help minimize the environmental dimensions of antimicrobial resistance. And that's the team that I lead at the AMR Industry Alliance. It's a team of scientists and engineers that are providing guidance to factories, not just our own factories, but to our suppliers, on the best way to manufacture without impacting the environment. So the AMR Industry Alliance has a lot of tools, a lot of engagement. And this is actually one of the few times we're ahead of the regulators. There's no regulation right now requiring us to minimize our discharges of antibiotics around the world. We're trying to get ahead of it because we know that this is considered, it's an important issue, and that we need a method and we need guidance on how to do that. So we've been spending a lot of time trying to develop best practices, roll them out, do training, and engaging with our suppliers and within our own companies to try to follow a framework on what good looks like, right? So that really is, you know, we're talking very high level, a lot of things, but these are really concrete things that a pharmaceutical company or a manufacturer of antibiotics can do starting today to minimize that environmental impact from antimicrobial resistance.
Joan,
but I would also, oops, sorry, yep.
Oh, no, I'm sorry to cut you off, but I wanted to ask you to say a bit more about, it's unusual for industry to be ahead of policy sometimes. And so can you say a bit more about that? Like how in this instance did it happen that it's industry saying, hey, actually, we need to do more?
Well, I think it has to do with, it was, you know, I think, you know, it wasn't like that there wasn't proposed regulations or the threat of regulations. What I think, actually, that's a really good question. Why we decided, I think because we were the ones in control, right? So we knew that if we had a process, the science really was not quite there yet. So Amy and her team are coming up with new and different ways of diagnosing what could be a safe concentration in the environment, either of an antibiotic or from a bacterial assay. And we felt that if we waited for the science to be 100% ready, which is what normally scientists do, it's sort of just like the same COVID, what we're seeing COVID, we have to act now. If we waited for everything to be perfectly buttoned up and I's dotted and T's crossed, we would be 2025 and way beyond. So we developed science-based targets, and we call them targets because there's something to shoot for, and then we're working to refine them as we can. And we've had stakeholders who are from industry, who are from academia and from the governments, who are following our work closely. And as the EU pharmaceutical strategy gets developed, we're hoping to partner with them and to leverage everything that we've done in the AMR Industry Alliance so that we can hopefully come up with a One Health approach that everyone can use.
So that's interesting. So what I'm hearing you say effectively is that it's good business to be paying attention to these things. It's actually not just good policy, but it's good business to do this stuff properly. And then you took, go on.
Sorry, and I was going to say the other key thing is it takes time, right? It takes a lot of time for a manufacturing facility to change their processes and to get where they need to go. And we felt it was really important to start now as opposed to just waiting. We can sit and wait for a regulation, and then next, you know, it's going to be another 4 or 5 years to implement any changes and things like that. So we felt that it was important not to wait.
So Joan, I've got a whole bunch of putting you on the spot questions now. I hope you're ready. So one of them is, can you tell me about multi-stakeholder approaches? So you talked about the, I don't know if I noted it properly, but there's an alliance that you guys are part of shaping. What about patient involvement in that? Because we've heard about the importance of engaging patients and about multi-stakeholder approaches. Can you tell me about the patient involvement and the multi-stakeholder elements of that?
I think the patient piece is probably the weakest link, and I think that's where we need to do a little bit more work. We've been working very closely with hospitals and diagnostics and teaching making sure that the right antibiotics go to the right patients. But I would totally agree that there is more that we can do on the patient engagement piece through the conversations with the providers and with the pharmacists, right, so that they can understand. I think a lot of it is, you know, the pharmaceutical industry has so many tools and models and information that sometimes just doesn't get out there, you know. So Kirsty and I are trying to make sure that all of the good work that we're doing is known, and we tend to just leap over the patient and go straight either to the regulator or to the policymaker. And sometimes we need to make sure that our messaging gets to the patient as well.
So Karldeep, can I turn to you on that note and say, there are so many places where patient engagement could happen, but it's probably not possible because it's too much work for a patient to have to do. Is that the case? Are there places where you think patients are best engaged? Because Joan talked about, you know, they're engaging with hospitals and pharmacies and all these other providers. And do we expect that they should be doing better patient engagement? Where does it fit together in your mind?
Yeah, I think this is, again, what we learned in this COVID situation right now. You know, when there was a big business about tests, trace and isolate, and everybody thought, oh, if we have a central system, that will work for us. But no, in the end, it turned out we need local systems. So every health facility has a part to play in it. For instance, my general practitioner, they don't need a number of patients. They just set up 3 or 4 who can sit with the planning committee when there's going around, especially on the disposable issues. Simple health surgery is connected to 5 or 6 pharmacists in the area. And if you jointly have an issue with them, discussion when these things are coming in, how can we deal with disposal? They can do that. So we build in, I mean, it's a body, the most untapped and largest asset the health system has as expert patients. And we're never tagged into. I mean, it's a very bizarre system. Everywhere else where you've got products, consumer, every other industry uses the users, you know, to pinpoint what's going wrong and what's not, and they'd come and design better, like iPad, iPhone. I mean, you can see that going, but I've never seen this taken on by the health industry that seriously. We still have that thing that there's a skew of information, and well, patients don't have room here, and they don't have this, and that silo mentality needs to now vanish, and we want to bring it. And just to say to Joan, I'll email you my bits for our board of director who's responsible for AMR. She's really pushing this so forward. We are going to be setting up a new organization in Geneva, looking at patient safety, part of our WHO collaborative. And one of our key pillars will be AMR action. And we'll invite you into that. Please do share with us, and Neda will make that process. So we just need to trickle down something, and then the rest is almost like seeding the health system with this idea. And then the watering and caring is done by the individuals who are there, the champions and expert patients, and they build on, and then you see the green shoots of change coming up from them. I think that they just need to buy into this whole debate right now, that this is serious, and we need political commitment on this as well.
Okay, thank you for that. I'm going to open the floor up a bit more and ask the other 3 panelists to rejoin us. Kirsty, I know that this topic touches quite deeply in some of the work that you're doing.
Definitely on the AMR, but also on the patient engagement aspect. Within FPIA, we were part of a project, even MSD, I was part of a project called IMI Paradigm. It was about engaging patients and patient engagement across the whole medicine's life cycle. And it's just coming to an end now, actually next week. A bit delayed because of COVID, but as with many things. But it really looks at how to make patient engagement sustainable, how to involve patients along the whole process. Many tools have come through this in a roadmap, and it's definitely some aspect of where we can engage more on the issues on the environment also, for example. Part of this is also what we had was a patient engagement open forum. And here we bring topics for discussion which are of interest, and where we engage with all patient organizations, but patients themselves, and also the regulators and also industry, because we're trying to make patient engagement part of the normal culture, that it's not something we've told to, or ticking a box to say we need to do it, but something that just comes naturally through that process. And then as another step within FPIA, but this is more focused within on the level of patient organizations, is we have a patient think tank. It's co-led by EPF and FPIA, and it's where we bring topics for discussion, policy topics, where we really interested in the patient's view before we decide how we're going to decide on a position within FPIA. We want to make sure that we've taken into account the views of the patient. So definitely there are aspects here where we can take up many of the environmental issues, that on AMR maybe as a start to move forward.
Sounds like a great approach, Kirsty. Thanks for sharing that. I want to also look more broadly at the multi-stakeholder approach that Joan and Kavaldeep have already spoken to. And also, Jess, you also fed into that. You talked about where pharmacists fit in. Amy, can I come back to you about the other role of academia? A lot of our members are academics. We've got a lot of academic health managers who are either working purely in academia or as practitioners and academics. What do you think academia has to contribute to this issue of AMR?
So yeah, academia is doing lots of stuff across the whole AMR board. I think a key role of academia is, as Joan was saying, is trying to get that evidence there, which can, you know, inform the policy changes and the regulation. So yeah, as Joan said, I'm sort of more on the environmental risk assessment side and looking at what are safe thresholds of antibiotics. There are other groups looking at the human health risk assessment side. So once antimicrobial resistance is in the environment, how much of a threat does that pose to human or animal health? I think a really key aspect is going to be the social science. So communicating these things to patients and across, you know, all of the different stakeholders and all of the different industries. And then, yeah, there's the more fundamental sort of understanding the mechanisms of evolution in different environments, including in patients, in patient gut. And yeah, trying to relate that to real world stuff is, yeah, academia it needs to generate the data which can inform those changes and inform the best way to communicate what we've learned to the relevant stakeholders.
So Amy, you know what, we can be really frank here because you've got this great panel and you've already seen Carol Deep connecting with Joan, creating opportunities. We can change the world right now. So do you feel like you're getting the most outcomes of what's needed? When you think about where academia is influencing the data and what you're able to influence, do you have the right relationships there, or where do you think more attention's needed?
I think personally I'm actually very lucky. I have quite a lot of contacts, different policymakers and pharmaceutical industry, wastewater industry. But yeah, I think where the AMR Industry Alliance, like Joan was saying, is really, you know, doing great things, is trying to foresee the changes that might be coming and start to try and make changes now. Whereas some of the other things that might need to be done, you know, it's going to cost lots and lots of money. It's going to have energy, you know, carbon implications. And there's sort of maybe two groups of people. There's the one who are saying, yes, let's have the precautionary principle and we try and, you know, foresee things that are coming and try and make changes now. Because if we don't, then, you know, the outcomes are going to be really catastrophic. And then there's the other group, which are more, yes, we agree, but we need to have the hard evidence before we're going to start doing these changes.
Yeah, if I could add, I think one of the issues that I think is flat on the table that is going to be very difficult for us to handle is the issue of sanitation, wash, you know, just clean water, clean sanitation, not just from manufacturing, but just one of the drivers of antimicrobial resistance from an environmental perspective is that, frankly, that the wastewater infrastructure in many countries is just not adequate to remove all of the, either it's the plasmids or the genes or the low levels of pharmaceuticals. So that is something I think we definitely need partnership around, and we definitely need to work on.
Okay, so, and we've heard also about where academia fits in. We've heard a lot about the different elements now. Ferenc, I want to come back to you. You talked at the start about some of the Commission's policy framework. You talked about the Green Deal and the pharmaceutical strategy. Now that you've heard the comments of the rest of the panel, where does that, with all your expertise on policy, is that resonating with what's in the policy? Are you seeing anything that stands out most to you, or are you seeing any gaps in terms of the policy link to what's being said today?
No, thank you, George. So I think this resonates very well, and it a little bit confirms our efforts to get the opinion of the public and the stakeholders into our pharmaceutical strategy. So I think if you will be able to open the document, you will see a very important chapter also on the AMR issue as well. And I think from the Commission side, I think a lot of and also from the environmental aspect, a lot of projects that Kirsty referred to in IMI, you know, this is half the industry and half the EU's contribution to these projects. So we strongly collaborate, I think, with our industrial partners, and if possible also with patients and all the stakeholders. What I also think is that we need to think not only about the push incentives on AMR, but also on the pull incentives, and we are trying to engage in developing new antibiotics as well. So a prime example, I think, is the so-called HERA instrument, which previously was dubbed the EU BARDA. So it is the Health Emergency Preparedness and Response Authority that is going to be established, and it is meant to deal a lot also with AMR. So we hope that the stakes, also the financial stakes, will be higher, not only the legislative framework.
Terrific, thank you. I expect that you've memorized the policy framework, that you know pretty much every word in your head because of your policy expertise that you bring. So I'm going to ask you an in-depth question. Given that this is a health management conference, we have a lot of health managers. How much opportunity is there and information in that policy is there directly for health managers involved in implementation? Like, is this really for them, or is this just a segment for them? Where do they fit?
Well, the strategy, the pharmaceutical strategy itself, it's rather vague in the sense. So I think this is not necessarily the point of direct engagement, but this is the plans how the Commission is about to adapt the current legislation. And I think the legislation framework, the legislative framework, is a very solid one. We don't often change it, like in every 20-25 years, as it happens with the basic Pharma Act, human and medicinal products. So this is on the table. The Commission will come up with a proposal on individual pieces of legislation, and at each step we will again consult the stakeholders. So this is an overarching strategy. This is the directions. This is the problems that we identified, and then can come there. So answering your question, I don't think this is direct relevance for the health managers. The end of the product, the end of the project, so the outcome, the new legislation, that will be directly relevant to them.
Okay, well, let's hear more, because actually we have a hand up from the audience. So I'm going to turn to her. She'll be speaking it live to us. And there's also a question in the chat box I'll get to in a moment. So over to the live question. Hi, Annalise, thanks for joining us. Yeah. Annalise, you're well known to Emma, so thanks for being here with us. What's your question?
Thank you for being there, so I can get really interested. No, you know, I get loads of inspiration this afternoon. Our hospital in Deventer has as a mission. If you look at that strategic plan, they formulate the mission as follows: patient in control. I see Cavaldi smiling, and actually they bring that into effect. And another development here is patient-centered care, which I think is cool. Why is that new? Why is that new? And we're all talking about coordinating different sectors of healthcare or medicine or whatever. And I think I'd like to put it to the panel. Don't you think that we need to get back down to earth and really think about what patients really need? Because we have been developing and developing and developing. Medical technology has developed, and it's all based on the economy, of course. But what do you think could be a breakthrough? What could be a breakthrough strategy to cross through that? We can think of all sorts of measures and whatever, but if you think about it down to earth, we are all doing it for patients, groups of patients. How would you see that?
Okay, thank you very much for your question, Annalise.
Yeah.
So there's been a lot of discussion about patients, and I think what I'm hearing from Annalise is she wants something more radical. She wants more to be done. Does Kamaldeep or anybody else want to add anything in addition?
I think what Annalise raised is really over 70 years of slow build-up of systems and complicated care pathways, attitudes, and which has taken medicine away from the person and mechanized it, made it into, instrumentalized it, and sometimes given it a false hubris as well. You know, if we throw technology at it, we will do it. And if my thermometer says you've got 97.5 whatever degrees here, and that's the truth, but doesn't want to say if the patient is feeling warm or something else. So we need to go back to William Osler's, Sir William Osler's saying that, yes, a good health system treats the disease in the patient, and that a very good health system will deal with the patient with the disease, so the patient becomes a priority. And I think this is where we now need to look at it from medicine. I think it's a point of ethical concern. It's a reflection that after COVID, how do we go, where do we go? And I think we need to bring back those, dismantle silos, look at the patient-reported outcome measures. How important are these? That's the science that's coming through. And patient-reported experience, PREMs as well. These all need to be brought into it. And these will actually make our health systems much more effective, much more acceptable to the patient. Because medicine isn't like taking your car to your engine, to a garage, and they will fix you up by putting new parts in. There'll be outcomes. You have to live some serious operations, for instance, major surgery with a big tumor in there. We know that life will never be the same again, but it's now living with that. We need to make sure that this individual is happy with the outcome he or she expects and comes to terms with, and manages to live life in that respect. So yes, it's a rethink time, and you're quite right. We are not in control. We are partners. We are not in control. We are partners.
Thank you so much for responding to that. And Annalise adds that it is about what is right for the patient as a whole human being. Thanks, Annalise. There's another question which I'll come to, and we're in the last couple of minutes of the session. And once we answer this next question, I'm going to just do a quick round of the panel and ask you for your final thoughts about what more can be done to improve how we're addressing AMR and environmental sustainability. So any kind of closing comment that touches on this theme would be great to hear from the panel. So the question is, it's anonymous. Thank you for this great discussion. Should health managers be procuring products and services with more attention to circular economy and AMR? So I guess it's about the role of health manager. What can health managers specifically do to help improve this response? Is it how they procure, or is it something else? And maybe I'll start with going to Kirsty. Do you mind starting us off on that? From your experience, looking at the health management side, I know you're not a health manager, but clearly health management would cross paths with you. Do you want to start us off with that?
I can try. But
and then I'll go to Jess after you. So Jess, get ready. I'm coming for you.
But I do agree in general that there is a need to move towards more giving more attention to the issues which are affecting our environment, which directly or indirectly link across to our health. And therefore, this is definitely one of the aspects that needs to be taken into account.
Great. Okay. And Jess, do you have something to add about that? Thinking about health management in general, how health services are managed, what can they be doing?
I can definitely speak from a community pharmacist perspective that I think there actually is a lot of waste disposal that happens in community pharmacy, and there aren't enough ways to tackle it. So I think that how health managers could, I suppose, help tackle this issue would be to highlight the importance of recyclable products, and even like the packaging of medication and blister pack medication that we give to elderly people that aren't able to take their medications accurately during the day. I think that if they raise more awareness on these type of products and raise the awareness of recycling in pharmacies and in every health sector, that this would definitely help, and it would also help the environment as well, because at the end of the day, this is what we're supposed to do, and this all links in with the EU Green Deal too.
Good, thank you very much. We've got a couple more minutes, just enough time to do the round. And if there's any last questions, now your last chance to add your questions into the Q&A box. Oh, and of course, there's one right away. So Annalise, I see you're adding about health management. So health managers should be able to be experts in their patient needs. So that requirement can be fed to industry, health organizations and politicians on the various levels. Okay. So it's about seeing the health manager as part of a vector of information, of connectedness. And I guess this really connects to points you were making before, Joan, about the multidisciplinary approach. So Joan, you are very lucky to be chosen as the first person to do your general reflections. So what's your final comments?
I think actually my final comment actually relates back to that last question we had, and it has to do around sustainable procurement, right? So that's another piece of critical thing that the industry needs to do, is we have to make sure that when we source our ingredients or our products or our packaging, that we are getting them from a sustainable supplier as well, right? So I think you're going to see in the not too distant future a lot more sustainable procurement initiatives, either within industry or as part of things, and that will help drive that circular economy, and it'll help make sure that that the issues that we're seeing are more collaboratively handled, right? So it's not just one person, I'm doing my part. You have to make sure that everyone that you touch, you're also doing their part too.
Great, great. Actually, EHMA has a key piece of work on sustainable procurement. It's definitely a key issue. And I'll just remind people in the audience that environment is one of the themes. So if you want to keep talking about this session, then do stay connected with us. And even in the conference app, do check that out and go to the MSD booth, because you'll find a lot of information there about things that have been discussed. And if you haven't had a question answered or you wasn't sure how to frame it, you can go to the MSD booth. You can see who you can contact there. So there's lots more chances for you to get more information. So I'm going to now go to Kawaldeep. What would you like to say in summation?
I think we need formal, legal frameworks in place that set the role of patient in the health systems, and especially on AMR. I think the talking wouldn't help us. We need formal engagement, and I think EHMA has helped us a lot in a way that it has those in place. Thank you.
Thank you very much. Amy Murray, so you've heard all that discussion. I've put you on the spot to be the spokesperson for all of academia. What are your concluding comments?
Agreeing comments. Yeah, I think thinking about the whole life cycle of antibiotics. So yes, from responsible sourcing through to proper disposal, and then obviously the environmental aspects. You need increased awareness and understanding to be able to do that. You need policy changes in terms of what health stakeholders could also do potentially is you can't just say reduce use of antibiotics. If a patient needs antibiotics, then you should give them to them. But perhaps in time we could look towards having maybe a hierarchy of, if a patient needs an antibiotic, if there are several antibiotics to choose from, could we prescribe one that was more environmentally friendly? So introducing something like that. Yeah.
Okay, great thoughts there. Kirsty Reid.
Just to say that industry will continue. We realize that we have a role to play. We acknowledge that we're part of the problem and we're part of the solution. So we will continue. And also there is a strong need and for continued and further developing involving the patients through the whole medicines life cycle. The patient doesn't want to be contacted and give input in one aspect of a medicine's development and not know how it has benefited them, but involve them through the whole life cycle helps to bring they understand the benefits and they're able to input through that whole process. But also just to mention that, you know, everyone participating here today, that, you know, this is also a moment to be heard if you have your own comments to make. The Commission for their Green Deal, they have a number of open consultations as they work through various issues. Presently, they have an open consultation on packaging. They have an open consultation on the zero pollution. This is your opportunity to provide your feedback to how you feel about these various initiatives that will be put forward. And you can also help develop as Europeans what comes out in the policies in the end.
Great additions, and thanks for that reminder of what's possible and to stay part of a multi-sector response, that we're all part of this and we all need to feed in and give our feedback. Thanks for your time. Jess Mcnamara.
Okay.
What are your concluding thoughts?
First of all, I'd like to thank Annalise for highlighting further about the patient perspective and how we can protect the patient, because I think one of the first things we learn in pharmacy is that the patient should be the center of our approach always. And often for pharmacists, well, for patients, that community pharmacists or hospital pharmacists sometimes are like the last contact that they have before taking their medication. And I think this can have like a really big effect on the patient, the way this is communicated. And in regards to AMR, this is also very important because pharmacists can help to reduce unnecessary use of antibiotics. So for viral infections, for example, or the incorrect antibiotic treatment for patients, you know, make sure that the patients are finishing their antibiotic course and that kind of thing. So I do think that that is why I focus on the curricula aspect for students in pharmacy, because we need to be taught this about tackling AMR or antibiotic stewardship and disposal of medication, because this helps to give students more background information on sustainability, and this all impacts the patient in a positive way. Thank you.
Thanks, Jess. And it's interesting because access to antibiotics varies across Europe. Some countries have strict prescribing guidelines and others have none. So, or very little. You can buy them over the counter. So, so a lot to do across Europe, across sectorally. So finally, Ferenc, I want to come back to you. What are your concluding ideas?
Thank you. Well, first of all, I would like to echo what Kirsi has said. Kirsi has said that there is opportunity for give your inputs on our public consultations, and we are more than happy for them. And my concluding remark would be that that I think we could learn a lot from COVID. And the lesson that I've learned is nothing is impossible. If really governments, regulators, and the industry puts together their forces, we can overcome, you know, obstacles that seemed impossible, just like, you know, developing a vaccine. So I think for us, the lesson is that we have to continue this way of very engagement and learn the lessons from this spectacular problem and maybe repeat it for AMR or for environmental issues and try to find solutions.
Great. And Kirsty did mention that there's lots of opportunities for people to feed into the decision-making process at the Commission. So I encourage people to check them out. Joan, as the last comment, you mentioned that you had a quote that would be worth sharing.
Yes, I think this is as MSD is sponsoring this session, I just wanted to read a quote that came from our founder, George Merck. He wrote it in 1950, and it says, "We try never to forget that medicine is for the people. It is not for the profits. The profits follow, and if we remember that, they have never failed to appear." So the whole issue of a patient-centric model is really foundational to the pharmaceutical industry. And I think I appreciate that this session has really cemented that for me and for us going forward. So I appreciate the the information, and I appreciate all of the feedback from everyone at this session.
Thank you for that beautiful quote. And I just want to thank everybody for attending. I thank you for your generous time. I thank you for the connections and for sharing your great insights. Thanks, MSD, for your sponsorship of this. And I'll see you all in the next session. Take care. Go back to the conference app and find your next thing to do.
Thanks very much.
Bye, everyone.